Good morning. I'm Niraj, second year nursing student in Western Sydney University. Today, I'm going to present on stroke and talk about one clinical manifestation and a high priority nursing intervention in relation to the case study of Mr. Mark. A stroke normally occurs when there is a sudden loss of neurological function, which could be either due to lack of blood flow or a rupture in the cerebral blood vessel. Do you know stroke is determined as the second leading cause of death? It affects around 13.7 million people and leads to 5.5 million deaths a year worldwide. My presentation today will cover right-sided facial drop as one priority clinical manifestation and will discuss the underlying pathophysiology causing the clinical manifestation. Also, how the symptoms can be improved through a high priority nursing intervention in the case study of Mr. Mark, who admitted to the hospital with the stroke symptoms. When the patient gets admitted, A to G assessment is the primary element, which is used to identify the clinical manifestation in an emergency situation. In the case study of Mark, the A to G is assessed and the first test is used in disability section to identify the symptoms of stroke. Mark is diagnosed with stroke symptoms like a right-sided facial drop, cannot lift right arm, right-sided weakness, speech is slurred, unable to speak clearly. So in this scenario, time is critical as a nurse and requires a quick nursing intervention, as shown in the picture of stroke foundation. The right side facial drop is the clinical manifestation of middle cerebral artery ischemic stroke. The middle cerebral artery are blood vessels that supplies blood mostly to the lateral surface, parts of basal ganglia, and the internal capsule through four main branches, M1, M2, M3, and M4. Now, I would like to draw attention on M1 vessel in the middle cerebral artery. This vessel transports blood to the basal ganglia in the lateral cerebral cortex, which is responsible for the motor and sensory functions. However, it is important to note that any blockage in M1 vessel obstructs the oxygen and nutrient supply, causing damage to the basal ganglia and the internal capsule. This results in contralateral hemiparesis, sensory loss, and paralysis in the face and upper extremity. Right side facial drop is one high priority clinical manifestation I'd like to point out on Mark's case. When M1 blood vessel that supplies blood to the basal ganglia is obstructed due to the tissue necrosis of the primary somatosensory cortex, this causes loss of sensory and motor function on the right side of the face, resulting right side weakness or facial drop. Once the stroke is identified, time is a crucial factor to act fast. Neurons can only survive for a few minutes without oxygen supply. Millions of neurons die every minute without sufficient blood flow and the damage cannot be restored. Hence, cerebral infection can cause death and permanent disability. However, if stroke is identified and treated on time, more than 80% of stroke can be prevented. In addition, early treatment can result in greater chance of recovery and reduce the possibility of permanent disability. I will choose identifying dysphagia as one high priority nursing intervention to improve the clinical manifestation of right-sided facial drop. People with acute symptoms have lack of muscle strength in the mouth and tongue. About 40 to 65, sorry, it's 50 to 65% of stroke patient with altered level of consciousness experience dysphagia, during the acute phase of the stroke. Dysplasia can trigger serious complications like aspiration and pneumonia if not recognized early. Right-sided facial weakness can trigger tongue weakness, causing difficulty chewing and swallowing the food. During the normal swallowing process, different muscles and nerves are used to transport food from the mouth to the stomach. If the brain cell that controls the muscles and nerves are altered, the patient will experience swallowing difficulties and there is a high possibility of food blocking the airway. As a result, patient can cough and choke and can trigger aspiration pneumonia. In the case study of Mark, the symptoms of dysplasia needs to be identified as a priority nursing intervention. If Mark experiences any feelings of difficulty swallowing, lump in the throat, coughing or choking, or any shortness of breath, all of these above are signs and symptoms of dysplasia. Therefore, Mark should be observed closely for any dysplasia symptoms. His vital signs should be monitored regularly and should be kept nil by mouth until observed by the stroke team. Finally, to conclude, I would like to conclude my presentation by addressing the main points. The essence of understanding the significance of stroke and why fast test is so critical to assess the symptoms of stroke. The above discussion summarizes that Mark is admitted with the obstruction of left middle cerebral artery that provokes the injury in motor and sensory nerves, triggering the weakness on the right side of the face. More importantly, due to the right side facial paralysis, one high priority nursing intervention should be keeping Mark nil by mouth until observed by the stroke team to prevent from worsening of stroke and dysplasia symptoms. Hope I have answered all the questions in detail on my presentation and made clear understanding in Mr. Mark's case study. Thank you for listening and for your time.